Okay, we're going to talk about what to do when a patient comes to see you and they have a fish hook stuck in them. There's 3 methods we're going to talk about in terms of how to remove that fish hook. First things first, patient got a fish hook in them, protect yourself, okay? A lot of these hooks will have 3 or sometimes even 4 barbs coming off of them. If that's the case, get rid of those barbs. Make that the first thing you do, because inevitably what's going to happen, you're going to move, the patient's going to move. Now you're going to have a fish hook stuck in you as well, okay? So you're going to have to go to your equipment drawer. You're going to have to call the maintenance man. You're going to walk out to your own vehicle. You have to get something to cut the barb off of that hook. Know that those barbs will go flying when you cut them off. So usually I'll have something like a 4x4 there. I'll cut that barb off. That way the barb doesn't go flying, somebody doesn't step on it, doesn't hit somebody in the eye, something like that, okay? So first things first. Protect yourself, get rid of any barbs that could stick you too, okay? So technique number 1, patient comes in, you've gotten rid of any barbs that could poke you. How are you gonna get this fish hook out of this patient? Well, don't forget, don't do what I'm gonna do. Don't forget they've got that barb on the end, and if you yank it out of a patient like I just did this poor piece of chicken, it's gonna get hooked, it's gonna get stuck, it's gonna tear and rip and be very painful, okay? So we can't just back them straight out. Those barbs are too caught in there. So what are we gonna do? Well, first things first, this thing hurts like a dickens. So we're gonna clean the skin. And then we're gonna numb the patient up, okay? So we're gonna give them a little local and numb the area. 3 techniques, 3 ways we can get this fish hook out. Technique 1, we're gonna push that through the skin. We're gonna cut the barb off. Remember, these things will go flying. So we're gonna cover it with something like a 4x4. Hear that? I mean, when I say it went flying, I don't even know where it's at right now. Okay. And then once we've cut that barb off, we can back that hook out without damaging the skin. Okay, that's technique 1. All right, technique 2, and this one's a little bit more challenging, but it can be done, okay? Let's say you don't wanna push that hook all the way through because you're afraid you're gonna hit something you don't wanna hit. You wanna be able to back it out. You can take an 18 gauge needle, go in at the same angle the fish hook went in, run it along the curve of the fish hook and see if you can't capture the barb in the tip of that 18 gauge. Okay, this one's challenging. So I'm gonna run along the tip of the hook. I feel the curve of the hook. Can I feel the barb? I can feel the barb. The question is, can I blindly get the 18 over it? And if I can back them out together. Again, covering that barb so that it's not just ripping and tearing all that tissue as we back it out. And the third and final technique, again, we're trying to disengage that barb and keep it from doing a bunch of damage on the way out. If you tie something around your fish hook, so something like a suture with the needle cut off, push down, directly down on the fish hook. This disengages the barb, okay? The barb's no longer stuck deep in that tissue anymore. Pull. So as you're pushing down, you're pulling on that string and removing that. And I'll show you one more time. So pushing down, and by doing so, we're disengaging the barb from the tissue it was caught in. And then we're pulling it directly out at the angle it went in. Once that fish hook's out, what do? Well, you're gonna irrigate the wound, okay? Good luck getting an itty bitty tiny puncture wound super clean. And because of that, you have to be thinking, does this patient need prophylactic antibiotics? The American College of Emergency Physicians says Yes, if it's a dirty needle. And they say if the needle was in fresh water, your patient should be on fluoroquinolone. ASAP says if the needle was in salt water, your patient should be on doxycycline. Okay? Really superficial wound, probably don't need to cover, but by and large, we cover most of these wounds that were caused with dirty hooks with antibiotics. Don't forget to make sure your patient's tetanus vaccine has been updated. Okay? Last thing is we see a lot of these in the finger for obvious reasons. If you're concerned that this thing's going to go into a joint or already is in a joint, don't hesitate to get an x-ray.